Mental pressure, I would definitely say it will be there. I think it will be there in any job, even in your lecturership or a clinic, how it runs or anything. Having access to much of the sensitive information which the pharmaceutical company.
How well do you enjoy this work? You can be frank with us.
We can start somewhere around 30K per month, along with other incentives, which once you come into a system, you would definitely feel that pressure kind of thing because you need to answer somebody. But after the training period, I think it's quite good. You don't have anybody who's
How good is the work-life balance? And is there any supervisors who's micromanaging your activities?
I wouldn't want to sugarcoat this, but work-life balance, if you are able to manage it, definitely good because we have a 5-day work. And coming to the management part, during the training period, because if you are an independent clinical person previously, once you come into a system, you would definitely feel that pressure kind of thing because you need to answer somebody. But after the training period, I think it's quite good. You don't have anybody who is literally micromanaging you. Once your work is done, I think you're free to go. There's no restriction on the timings as such.
Is there any strict requirement to meet a target? Does your work depends on that?
No, not as such. Not like in kind of sales role what we hear. We do not have any targets, but I would say that because these are project-based jobs, so the projects as in when I say we have something called as quarterly or half yearly, depending on the project, we would have a quarterly snapshots, half yearly snapshots and database logs. So those are the times where you will feel that there is too much work and you need to maybe stretch on the weekends also, but that comes depending on the project. It comes once in a 3 months or 6 month period.
What are the critical company expectations from the employees?
The main one I would say for the company is your deliverable, which should be on time. Like the one thing, your job should be done on time, and the next important thing for a company is the error rate. Like whatever queries you're sending out, whatever data you're correcting, there should not be many errors. Human error is possible, definitely, but there is a minimum error rate which you should be maintaining because as we know, these trials are all including all the FDAs and various other company regulatory authorities. So the error rate should be minimized. That is the only expectation from whatever the job we are given.
So how healthy is your work culture and what is the work atmosphere? Because during your UG and PG, we are surrounded with instruments, blood, patients, saliva, and suddenly you're switched to a place where there is, laptop people. So how is it?
So coming to health, if you say physical health, definitely there's no blood, you won't be seeing any people. There are some days you won't even know how is the weather outside. But mental pressure, I would definitely say it will be there. I think it will be there in any job, even in your lecturership or a clinic, how it runs or anything. So that way, yeah, it is there, but you have 2 days to cool off and then come back to the pressure cooker again. So you can pretty well balance it if you can. It all depends on, again, if you're interested in this work. See, there are some people who, come into dentistry without willingness. So they might actually like the, engineering kind of stuff. So for those people who would want to fidget with gadgets, it would be a blessing to sit in the AC hall and, work with the gadgets.
Doctor, does this job require any legal bonds or contracts?
Not from the employee side. We do not sign any legal bonds or anything, but as long as you are in the job role, because you will be having access to much of the sensitive information which the pharmaceutical companies are trying right now. It's not yet into the market. So the employee is bound to company confidentiality, where you cannot reveal on what you are working. Like you can say the area you're working on, therapeutic area, but not on the molecule in which you're working on. So that's the company confidentiality. When you enter the job itself, you are bound to that. But other than that, you are not signing any legal bonds or anything.
How well do you enjoy this work? You can be frank with us.
Of course, I do thoroughly enjoy my work because one thing, as I said earlier, I've in the past 1 year, I would say I've been working on non-small cell lung cancer, psoriasis, systemic lupus erythematosus, rheumatoid arthritis. So it gave me a way out of dentistry. So I feel more of a medical person rather than just restricting myself into dentistry. So it gives me more joy that I can reach out to wider area of expertise.
Doctor, is there any scope to work abroad? Because my batchmate, she is settled in Germany and she was doing very well. Yes, Hita, I'm talking about you. So, doctor, how is it?
Of course, because most of these companies are multinational companies, we do have opportunities abroad. It all depends again on how you improvise yourself, because just with BDS or MDS, it's not possible. Maybe you would have to do a program management or some courses which would take you there. But definitely, because all the companies, all the CROs are present worldwide, and these are multinational companies. So we do have a chance to go there.
Is attrition an issue for this job? And do you see any quitting patterns among the employees?
Attrition, I would say, is an issue for the employer more than an employee, because the employee has more opportunities and he or she is free to look up. See, if you are in clinical research, not necessarily you should be liking that. You can be a writer. Medical writing is an option for you, so you can as well pursue your career into that. Or you can be interested if you are an MDS in public health especially, so you would be trained in statistics, so you can look opportunities based on statistics also. So for an employee it is not a bigger problem, but for the employer, yeah, attrition is a problem when the employee quits. Yeah.
Now, I believe there are postgraduates who have joined this job, especially the postgraduates who is cleared from the GDC government colleges. And why do you think that they have joined from a clinical to a non-clinical role?
Yeah. Also, my colleagues, I have seen some of the postgraduates from GDC especially, and that too in a clinical branch, like something like OMFS or even orthodontists. So the reason why what I heard from them was, one thing is they like the work-life balance here because it's a 5-day week, and also the incentives like I mentioned previously, that is about your insurances and the leaves which you get, or the long weekends how the IT employees enjoy. So those kind of things. So especially one of my colleague mentions being a surgeon, she didn't, it's a her, so she didn't have time for her family nor to, for herself, because she had to run a lot of consultations. But once she came into the job, she started enjoying her work-life balance. So that's one of the major reason I think people are shifting even from the clinical branches.
What is the average pay scale a person can expect?
For BDS, I would say we can start somewhere around 30K per month, along with other incentives, which depends again completely on the company. And if you are already experienced, even if you are a BDS person, although you have experience in the clinical field, that would be considered as experience, and your salary completely depends on that. And for an MDS person, your MDS is considered as an experience, so that gives you already 3 years of experience. So you can start anywhere from 45K to 50K, and then it goes with your corporate experience. The hike depends on how you perform in the corporate field.
Do you think this job can be pursued for a long term, and how can one sustain it?
So for a long term benefit, I would say it completely depends on your interest again. So if you're not interested, you also have options to switch inside this, like I said, medical writing or statistics, pharmacovigilance, and there are newer courses also, something called as medical coding and imaging also. So you can switch among these also. And for persistence, I would say if you get really, if you gel with the corporate culture, if you can manage people with writing emails especially, which is a skill, which is a soft skill. I think as dentists we are not completely aware of it. If you can develop that, it's not a difficult task to sustain in this field.
Will the company provide us any experience certificate?
Yeah, so once you get out of the company, like once you finish your term and you would like to quit for whatever reason, they will give you experience letter for the amount of period which you have served there. So some of the companies do have some policies like, if you quit within 1 month, you're not going to get any experience or anything. Some of them also have a 6 months probation period, which will be considered as your trial and error period. So they might not give an experience in that period as well. Otherwise, the minimum notice period, if you serve in a company, they do give a experience letter.
So Bangalore is known as a Silicon City or the IT hub. And do you think these kind of companies are located only in Bangalore?
No, previously yes, they were starting in Bangalore, but right now they have been expanding to even the non-metros. Like for example, my own company, they have recently started a branch in Kochi. So they also have branches in Hyderabad, Mumbai, Delhi, and also in Gurgaon. So not necessarily it is only in Bangalore, but non-metro cities are also been invaded by these companies. So your job opportunities are even more expanding.
Would you like to convey any message to our freshly passed out graduates or postgraduates, especially those who are looking for this kind of a job?
Yeah, of course. So anybody who is looking, not just BDS or MDS, doesn't matter. So anyone who is looking out for clinical research or non-clinical jobs, so first thing is, you should check for your interest. Like I said, it could be trial based work. Like I am very interested in trials, so I have chosen this. It could be writing. Like I have seen many friends of mine who are very good at writing. So you can use that to make a career out of it. So there is medical writing, which is really booming up these days. So you can go there. If you are a good mathematician or statistician, I would say learn some basic languages like R, SAS, some programming languages which are used commonly, and then make a career out of it. So depending on your choice of interest, you can have a varied options here. And the best part, I would say, when you compare it to your clinical practice or your college job roles, is the constant pay. So you do not, of course, nobody want to worry about the finances after finishing your graduation or post graduation. So the constant pay and the incentives make a good boost to work in this field. So choose your interest, and then you can shine well in that.
Doctor, one final question. So there'll be a lot of confusion between choosing a clinical and non-clinical role. So can you just address some advantages and disadvantages between these two?
Advantages, like I said, is the constant pay. Definitely it's gonna be your backbone to keep you moving in this field. And coming to disadvantages, just like I had, I would say you will definitely have the fear of missing out, like how this Gen Z is doing it now. So you will definitely feel that you are being taken out of your, fraternity. Like you're no more associated with patients directly, you're no more associated with the clinical setup, not with any kind of blood, or you're not treating them directly. So that kind of fear will always be there. If you have that, then it would make make it little difficult to continue. But otherwise, if you already made up your mind, like I have seen few of my friends who are practicing also and simultaneously doing this job. So they are kind of trying to figure out. So unless until you figure out one thing, maybe you can juggle between both, and then once you are through with it, you can choose one of the options.
Let me take this opportunity to thank Dr. Yogita. She's taken her time out of her busy life schedule. Doctor, I'm so thankful for sharing all your views, and I'm sure this episode will be of great help, especially those who are looking for non-clinical options.
Thank you, Dr. Prince, for having me here, and also thank you to the channel Dental Treasures. And I hope this episode clears some of the doubts for those who are trying to pursue careers in non-clinical fields, and also all the best to all those who are choosing their careers based on clinical research or statistics or anything, pharmacovigilance, etc. All the best, and thank you, Dr. Prince.
So with this, we conclude a highly interactive and informative session, and I hope all your doubts are cleared. And if you still have doubts regarding a non-clinical field, don't worry, we cover your backs. Please stay tuned for the future episodes. So Dental Treasure is a community where we help each other. So if you want to be a part of this show, please feel free to contact me. All the contact number and the links is given in the description. So don't forget to like, share and subscribe this channel. Until then, signing off, Dr. Prince. See you in the next episode.